My name is Dr. Joel Collins. I'm a clinical haematologist. So I'm trained as a specialist in blood disorders, and I treat a range of blood disorders, including blood cancers. And I've become really interested in iron deficiency over the last 10 years, and it now forms a significant part of my clinical practice. So it's interesting how I got involved in iron deficiency. I came to it almost by accident, so to speak. As a haematologist, I would see patients who had various blood disorders, and it would become apparent to me that they had iron deficiency. And so I would try and get my own patients from my private clinical practice to have iron infusions in the community. And I realized that it was actually hard for me as a haematologist to get my own patients in for an iron infusion. It was either difficulty accessing the public sector, or the ability to do it in private hospital day units, which was expensive, or there was long wait times, or additionally, I just simply could not get access to them. So nearly 10 years ago, I decided to just start doing some iron infusions as part of our regular clinical practice. Some of my other colleagues, other specialists, and particularly the obstetrician and gynecologists, were the first colleagues who realised that I could help their patients too. Fast forward to now, where we've grown to be doing more than 4,000 iron infusions a year. As a blood specialist, I've become really interested in iron deficiency, having seen just such a large number of people who are iron deficient, and realising that the lab values don't suit everybody, realising that it's such a big problem. 1 in 3 women being iron deficient, 1 in 5 for children under the age of 12 being iron deficient, and more recently, it's become far more apparent in our field of medicine and in general that athletes, and not just elite athletes, but regular everyday athletes such as parkrunners, are becoming iron deficient, which we'll talk about in a separate video, that it's really such a big problem, and how easy it is to treat, and how our service was created to get all of these people, whether they were insured, whether they weren't, to have access to an iron and anemia service that was run by a blood specialist, and that these infusions were cost effective, easily accessible, and in a really safe environment. That's what I wanted to create, and that's what we have created.